Next up, we have the College of Health and Agricultural Sciences, who will present on creating a UDL ripple effect through collaboration and training. Our faculty partners from the College of Health and Agricultural Sciences are Dr. Frida Brown, Professor Deirdre Campion, Associate Professor Katrina Cunningham, Dr. Tom Flanagan, Dr. Phil Halligan, Dr. Karen Keaveney and Dr. Deirdre O'Connor. That's the biggest college that we have here in UCD, which is why we have so many faculty partners, but not all of them are going to speak today, but they are all here. So up you come.
Thanks a million, Julie. And thank you, everybody, for being here. My name is Dr. John Gilmore. My pronouns are he or they, and I'm an assistant professor in the School of Nursing, Midwifery and Health Systems. There are my slides. Just to introduce us as a team, and one of the things I came to UCD in March 2020, so just amidst the pandemic, and actually there was a question earlier around how do people maybe who aren't in positions recognised as powerful positions kind of create change, and I think a lot of it is around finding your tribe, and I think the Faculty Partnership Programme has certainly given a lot of us the potential to meet people who are committed to creating the university for all and come together and think about collaboration and working together, and that's been very welcome. So these are all the faculty partners which were already introduced by Julie, so thanks very much, and it's been a real honour to work, and we have worked well together as a college but also within our individual schools and units. So there's kind of three parts, and I suppose I'm going to talk first of all on behalf of myself, Phil, Katrina and Frida around our experience of rolling out the digital badge and how in the college we rolled out the digital badge in different ways. Then we're going to have Deirdre and Karen's presentation, which is around kind of positioning the digital badge and universal design of learning within a wider equality, diversity and inclusion framework. And then we're going to think from Deirdre and Tom around kind of some of those traditionally high point kind of courses, medicine and veterinary medicine, and engaging in this work in those areas. So from our perspective within our school, we worked together as a School of Nursing, Midwifery and Health Systems and a School of Public Health, Physiotherapy and Sports Sciences. I think I got that right. That's always a tricky one. To come together to provide, I suppose, a collaborative approach for our colleagues to engage with the digital badge, both a local and national rollout perspective. And I think one of the things that certainly kind of met our success, and I'll talk about numbers in a few minutes, is an already established culture of inclusion within our schools and within the college. And I think it kind of matches quite well. A lot of our work is in educating and training healthcare professionals. So therefore, you would imagine that kind of there is an understanding around person-centeredness and around kind of universal kind of accessibility and the need to kind of provide that level of individual support. But a huge amount of work has been done, and even within our team, within the two schools, I'm a newbie, but Katrina has a long established position in terms of widening participation, as does Phil, and Phil has done huge work in the field of nursing and practice-based education around supporting students with disabilities, and Frida was one of the early adopters around the digital badge and a facilitator within the national rollout as well. And that allowed us to really think around bringing our assets and bringing our strengths together, think about how we can provide as immersive and flexible an approach for colleagues to engage in the digital badge as possible. So we met and thought together on what was the best way, and there are lots of ways and lots of kind of scripts of how we might present the digital badge, and I suppose there's the kind of the traditional two, which would be the peer group, facilitating through peer groups or through workshops, and we decided we'd within our team run some workshops, and across the college then you'll hear later is the others supported peer groups. But I think one of the things we always prioritised was flexibility and adaptability and support for our colleagues, and that was one of the benefits with the local rollout, and we had many colleagues who engaged in the national rollout, was the approachability, I suppose. We got a lot of feedback around colleagues not necessarily having to attend a drop-in session or having to send an email, but they could knock on the door or they could see us in a coffee queue and have a conversation with us around their their badge. So rolling through, I suppose what was really important for us was around the +1, and I suppose making sure that colleagues didn't kind of get overwhelmed by the whole redesign. And I think we got some feedback around that as well, around how, +1 made them realise that they could do something small. We had colleagues who wanted to redesign their whole programme and module, and we kind of pushed them back into thinking in that way. And we had some really great examples of embedded universal design right across, and colleagues thinking about their next iteration and the next iteration beyond that. And in a lot of cases, colleagues were reflecting on what they aimed to do was engage in universal design through multiple means of representation, but in fact that stemmed them on to think about different ways, think about their assessments, to think about how they were supporting learners right throughout. So, we've been very successful as a college, and I think this is an example of how this faculty partnership programme has worked, in that we have some of the highest numbers of engagement within the School of Nursing, Midwifery and Health Systems. There's 3 of us working collaboratively, and we have huge numbers not only of people who are faculty within the university, but we've also reached with people who are supporting students through clinical practice placements, which is a core part of the student experience. So thank you very much, and I'll hand over now to Deirdre.
Great, so the first of the Deirdres, I can't remember the last time there were 2 successive Deirdres presenting. Okay, so good morning, and again, thanks to everybody, and particularly to the team and to Tom for a really kind of insightful and fascinating presentation. So I'm here on behalf of myself and my colleague, Karen Keaveney, from the School of Agriculture and Food Science. And as you can see, our focus really is on UDL through the lens of EDI, of Equality, Diversity, Inclusion, with kind of specific relevance to, I think, the first year student experience in our school. And I think for myself and Karen, our interest in this particular area stems from a couple of roots. One, we both teach very large-scale first-year modules. Karen has over 400 in her module, and I have a bit less, around 350, 320. And also just some of our other roles within the school. Karen chairs the Student Experience Committee in the school, and I'm the Associate Dean for Equality, Diversity and Inclusion. So when we were thinking about this, and I was kind of heartened and slightly relieved to hear Tom Tobin mention David Rose earlier in the context of EDI, because we were kind of struck by this idea that, the work of the CAST organisation, and the production of the guidelines and the updating of those guidelines, really what's being discussed there is the idea of, the next stage of EDI, really both requiring and benefiting from much more focus and much more kind of embeddedness, if you like, on issues of EDI, of equality, diversity and inclusion. So with that in mind, I realise that is kind of hard to read at the moment, but I've just reproduced some of the work of Nicole Tucker-Smith, who does a lot of work, it seems, with the CAST organisation also, just where I think she gives some kind of helpful insights into, what are the typical pillars of UDL that we're all becoming increasingly familiar with, to do with multiple means of engagement, of representation and expression, but also gives, I think, very concrete examples of what UDL through the lens of EDI might look like. So what does it mean for us in trying to kind of put that in practice with groups of students, and even in our own practice? So, so for examples, across the various pillars of UDL from an EDI perspective, how do we make environments that are more welcoming for students? How do we address issues of bias, our own bias, our students' bias, unconscious bias, implicit bias, and so on? How do we ensure that our curricula really capture very diverse points of view, and again are kind of representative of our broader student experience? how do we ensure kind of equitable access to students have a kind of an equitable access in terms of the voices and the voices that are heard. How do we ensure that participation is equitable again across all these different groups? So I think we were quite struck by, again, looking for kind of concrete ways in which we might approach UDL through the lens, if you like, of EDI. And I think also just to echo something that Tom mentioned earlier, while Karen and I have our own interest in this topic, I think it's also, useful for us all to remember that, this is really aligning with a lot of the university level policies and strategies. So what I've done there is just reproduce a couple of documents from resources that are available. So, for example, if we look at ALL's work on the toolkit on inclusive education, that speaks specifically, I think, to EDI issues. Obviously, the EDI strategy talks, I think, extensively about principles of universal design and how important they are for our kind of EDI activities, and also just the survey, or the strategy on kind of the educational experience, that third educational success and experience, which is the last one there. Again, that makes a kind of explicit reference to the principles of UDL and how important they are from an EDI perspective. So I think, this is aligning, I think, right across. Okay, so just one very brief point. I have just drawn some statistics from our widening participation data, which shows that in our school and our faculty, we have around up to 35% of students who are coming from underrepresented backgrounds, whether that is, socioeconomic disadvantage or mature or part-time or disability or whatever. So it really is incumbent upon us to make that diverse group of students feel that they are being treated equitably and inclusively. So our next steps, as I said, Karen and I are undergoing a process of engaging with our students through focus groups, through surveys. We're already getting, I think, very interesting work coming back on just the diversity of the student experience, of their first generation experience, of their juggling their family commitments and all kinds of issues. So I suppose it does give us the evidence really to proceed with some of the measures, I think, that we mentioned there, that Nicole Tucker-Smith has provided us with this. Apologies for the slight overrun, and thanks.
Great. Well, hello everyone. I'm going to speak, hopefully briefly, on behalf of myself and Tom Flanagan. Yes, the image shows relatively well up there. One thing my CHAS group learned was that I am slightly obsessive about imagery and colours. So I just want to reflect firstly on the image that you see there up on your... Yeah, I also don't know my right from my left, so the image over on that side of the slide, that is an image I put together to kind of reflect all of the different things that both medical and veterinary medical students are trying to put together, particularly in their early years. So I've got icons there for anatomy, physiology, for biochemistry, for histology. And students are having to juggle all of those different things, and they're also, at the same time, have to learn about professionalism, they have to learn about communication. So there's lots of things that are going on for these students. And so I'm presenting as, how do we deal with these content-heavy courses? And what are the particular challenges in and around that? So it encompasses both medicine and veterinary medicine. There are quite similar challenges between the two groups. So there's quite a content-heavy workload, and the content for these courses is based on partly tradition, but also on accreditors. And the curriculum can include quite a lot of basic sciences that students need to learn, all of which have almost a different language. So they'll go into one classroom and have to learn anatomy terms, and they'll go into another one and have to learn biochemical terms. And that can be quite difficult for certain students because they're learning new words. There are accreditation standards to be met, and there's expectations. Different groups all have demands on our curricula. You must have more of this, you must have more of that. No one says cut things, because it's all you must have more. On the side of the students, we have a lot of neurodiversity amongst our vets, medicine students. We also teach veterinary nursing, we also teach radiographers. We have a lot of neurodiversity and hidden disabilities, and quite often the students hide those disabilities from us and don't acknowledge them, they don't register for access. We have a great larger body of students than actually are registered. So we have to assume a student looking at us has some difference, some challenge. We have a lot of international students, we have culturally diverse students, we have a lot of social difference. Again, students don't always acknowledge those, so we need to be aware of them. There are high expectations. Sometimes our students might be the first member of their family going to a course like this, and they're perceived as prestigious. And that can lead to student stress and anxiety and a whole range of other things, all of which leads to challenges to us as educators to try and acknowledge them. And peer pressure, a lot of peer pressure. So, in the process of rolling out UDL to our fellow educators, for me and for Tom, it's more of a matter of trying to can't address all of these things, you need to know your students, maybe try one thing. And the things that, because I've attained the badge in 2019, I've been trying new things, trying different things. This is just a sort of table together showing under the 3 pillars: engagement, representation, action, and expression, some of the things that I've found and Tom is finding, and that we're passing on to other colleagues, what we found work for these types of students. Making sure things are relevant, making sure that students are rewarded for what they do. I give grades, for example, attempt these formative MCQs and do all of them, here's 5%. They're driven by assessment. Make sure the VLE is very well organized. Make sure people can find material. If there's patterns, highlight them. Stick to the relevant content. Don't give lots of extra. They don't have time. If you got chances for having hands-on material, even in COVID, that meant, for example, in medicine, material got sent home to them. Then it made it easier. Choice of assessment, I'm going to address that in the next slide. Guides, formats, forms to tell them what to do. All that helps. And I'm briefly going to talk to Tom. If you want to find more about it, you might have to ask Tom directly. This was an example of a choice of assessment. And this was set up for the class in medicine of about 119 students, where as step 1 in this assessment, they had to choose a team or work individually. And after that, they had to choose a particular topic and then the format for presenting that topic. As it so happened, not surprisingly, the majority chose to go individual, but that's typical of medicine. So briefly, I'm going to acknowledge my other colleagues that are taking on this challenge within our schools. I hope you know from the imagery there which school they belong to, and I'll leave it there.